So good evening. My name is Dina Goldberg. I'm Director of Provider Relations for Johns Hopkins HealthCare, and I want to thank you very much for taking your evening and spending it with us. A couple points about tonight, if I could just mention up front. We would love to have everybody put their cell phone on vibrate so that we don't have too many interruptions, but you know, I don't know how many folks are actually going to be coming because of some traffic difficulties, so we're going to move forward. In addition, we do have an opportunity for questions at the end of the official seminar portion, so if you could please hold some of your questions, or if you can't, you can definitely write them down if you have to leave a little bit early and just give them to one of us and we'll surely get back to you. A little bit about today. What we'd like to do as part of our overall provider engagement strategy is come like this to groups of physicians and also to administrators and office staff folks to really try to be as transparent as we can as an organization, to make sure that we're giving you meaningful information, tools that can help you, tools that can also facilitate the services that you need to get from us or in collaboration with us to help our members, your patients. So that's really kind of the overarching theme of what we're going to be doing today. With me today, I have staff from our Provider Relations office that you've seen up and about and around. And more importantly, we have our clinical folks with us today. Michelle Hawkins, who is the director of our care management area, will be doing quite a array of presentation for you and talking about our different clinical initiatives, our outreach programs, and giving you a lot of helpful information. And then, of course, also we have our Deputy Chief Medical Officer, Dr. Robert Kritzler, who wanted me to remind you that he is a practicing physician. He's a pediatric endocrinologist, and he does practice at Hopkins as well. So we are, I think we have enough information and enough folks here to go ahead and get started. You should have a packet in front of you, and that will be what we have as our presentation material. So right now I'm going to introduce you to Raymond Rooks. He is our network manager for this geographical area, and he'll be walking you through some of the information during the seminar. Thank you.
Thank you, Dina. Good evening, everyone. First of all, as Dina said, thank you very much for coming, taking part of your evening to spend it with Johns Hopkins HealthCare to learn a little bit more about some of the things that we have to offer for your particular practice. We're here to educate you, we think, and certainly inside your packet you'll find informational materials that you can use about each of our lines of business. And within the packet, some of the things that are there are forms as well as guidelines to help you through each of the products. These tools and resources can help you through what you need to know about each individual patient for a particular line of business that you might see. A little bit about the background of Johns Hopkins HealthCare. Johns Hopkins is jointly owned by the Johns Hopkins Health System and the University School of Medicine. We serve patients and employer groups throughout the state of Maryland, over 250,000 members in our 3 lines of business. We have a network of services, physicians like yourself that make up our network. We take your claims that you might file. We offer you customer service for any issues that you might have, medical management to help you and to assist you with the patients that you might need some assistance with, care management programs to help those people through their life, a 24/7 secure online web service where we've rolled out information to help your practice, including HealthLink, where you can access subscriber information, also pull your own patient rosters, things that can really help your practice